You might be asking what a nurse navigator is. A nurse navigator is someone that helps you through your cancer journey. The primary way I do this is through the MyRN line, though I will meet with you sometimes in person after your visit with the medical oncologist. The MyRN line is the main way that you will speak with me most of the time. This is a way that you'll report symptoms, ask for lab results, ask for refills. The number is 443-777-6976. It has a selection of options. If you need to speak with the nurse, you would select option 4 to report any symptoms or to ask questions about in detail test results, or if you have lab results that you really wanted more detail about. When you do call the MyRN line, make sure you leave detailed messages with your name, your phone number. The spelling of your name is really important sometimes. Believe it or not, sometimes there's more than one patient with that name, so that I can get back to you in a more timely manner if I know who has called. It's just important to be able to have that information off the bat to make sure that I can call people quicker without having to look things up. This has to be reviewed by the doctor, so it can take up to 3 days to get an answer, and often the doctors will see you after these tests are done. But if you wanted to have a conversation about these results, you would speak with me about them. Being a nurse navigator is different from being an oncology nurse because I'm not with you in person, giving you an infusion at the time. I'm more speaking with you about your symptoms, going over different parts of your cancer journey with you. Different times you would ask me different questions, we would go over different things. Often people forget, or they feel so sick at that time that they don't remember what they're supposed to do. I'm the connecting point between you and the physicians, the nurse practitioner, often between the oncology nurses down in the infusion center. If you have an issue, I might speak with any of those parties at the same time, and we would treat with those various parties. Also, I would also maybe talk to advanced radiology about scheduling a test, or at least pass that along to the doctor's secretary to schedule, as well as maybe the lab. Other departments such as interventional radiology, which would put a port in, various things that you would need during your cancer treatment. I would be the touch person that you would get in contact for those various things that you need. So during your cancer journey, we want you not to feel alone during this time. We want you to have that person that you can always reach out to at any time, most of the time during the day, that you can have that one person that you can touch base with and know that they will reach out to the other parties. So you never feel alone, and you feel like that one person's you're always speaking with that one person in the office. That would be me, that you would be speaking to most of the time. The thing I love most about my job is that I'm able to speak with you on a more personal level and know what your issues are at home. You wouldn't have to call various departments to make appointments and speak to various people. You would just have to speak with me to make all that happen.